part of Netflix has completely changed their lives, changed their career trajectories. It's inspiring, it's humbling, and it's a constant reminder that the goal for Tenalytics is not about you coming in to get a new skill. It's about you coming in to get a job. So we empower you to get a job. And I would like you to carry that with you as we get into today's session. So welcome again, everyone. If you are here with us today, it is because you are looking for something. And maybe that something is clarity. Maybe it's direction. Maybe it's that breakthrough, that career transformation that will finally let you leverage your healthcare experience the way you've always wanted to. Maybe you're a nurse. Maybe you're a doctor. Maybe you work in care. I have to say you're in fantastic company because we've worked with hundreds and thousands of people like you. Now, I know that we all live very busy lives between work, family responsibilities, handling your kids' schedule, trying to keep everything together. It means your time is precious. So if you took some time off to join us today, it is because you have a problem that needs solving. You have a need that needs to be actualized. And let me tell you what that need is, because I think I have a guess. You want to get into tech, health tech to be specific, but you also want to know what kind of opportunities exist for you. So maybe you have a medical background, maybe you have a tech background, or maybe you have none. And you're thinking, I do want to get into health tech. So how exactly do I do this? Well, you are not alone. And one thing that we do at Analytics is we provide you with the blueprint, everything that you need in order for you to get started. I want you to carry something with you. While everyone else is chasing saturated markets, and I'm talking globally, health tech in itself as a sector is exploding. Post-pandemic, I mean, we all remember 2021, 22, 23. The entire world realized that healthcare cannot exist without technology anymore. There was massive integration between healthcare and technology during the pandemic. I'm talking telemedicine, AI diagnostics, electronic health records, wearable devices, mental health apps, all of these, all of a sudden they stopped become they no longer were luxuries or nice to haves. They became essential infrastructure. And hundreds, thousands of companies are hiring people with the same skill set who can build and maintain tools like this, build and maintain tech like this. However, they just don't have enough qualified talent. They cannot find enough qualified people. And I have to say, today for you, that journey begins. So for the next hour, I want you to operate from a mindset of possibilities. What if it is possible for you to break into tech, for you to triple whatever your income is in 2026? What if it is possible for you to work remotely for companies in the UK, in US, or Canada and live wherever it is you want? What if it is possible for you to transition into health tech, even though you have zero medical experience, or you have medical experience, or you do not have a computer science background? So, how exactly can that become a thing for you? We're going to have that conversation today. But first, I want to get a real sense of the people in here. So I want you to type your name and your job in the chat. Let's see the collective ambition that we have in the room with us today. So in the chat section, I just want you to drop your name and your job. So you could say, my name is Lola, I work in operations. Or you could say, my name is Taiwo, I'm a doctor. I want to know the people that we have in the house with us today. Okay? Awesome. And I think it's also fantastic if we interact as well in class because it shows that we're really picking up things. Okay? Awesome. Monica, clinical research. Martha said she's a nurse. Ezine said she's a nurse. Amazing. Lukman is a nurse. He's a graduate. Amazing. Joseph is a laboratory assistant. Paula is a nurse. Okay, I'm a beauty, a researcher. Amazing. Askia is a support worker, and Ayomide is a pharmacist. Amazing. We've got so many awesome people in the house today, but remember what I said at the start, you are not alone. So take a look at all of the people that you have here in the room with you today. This is what I call collective ambition. Collective ambition is in the room here with us today, and together we are going to be demystifying health tech for everyone here. Okay, so I want you to get ready, get your notepad, get your pen, and then write down whatever answers it is that you have, because I'm going to be taking questions at the end of this session. I'm going to keep it very short, very impactful, and I would love to hear whatever questions it is that you have at the end of this. All right, so one last thing before we get started. If you have any friend, if you know anyone who you think is going to be amazing in tech, someone who you think, has always been saying things like, oh, I want to work in tech, but, they just never have gotten around to doing something like that. This is the best time for you to tell them, hey, I've got an amazing opportunity for you. Send them this link, let them join this conversation. And I promise you, it's going to be one of the most impactful things that you do for them this year. All right, now let's get into it. First thing, let's talk about 10 analytics. And that's the real question on your mind. What is 10 analytics? Who is 10 analytics? And why exactly should you care? Now, in your journey to finding 10 analytics, you must have done your research. I hope you did. When you first joined the call, you saw some of the videos that we played at the start. You must have watched some videos on YouTube, on LinkedIn, and you see that we talk about real people. That is exactly what our model is built on top of, real people. Now, we've been doing this for over 5 years. And the main thing that we answer, the main question we answer is, what happens when you have all of the skills that you need, but you cannot find a job? What happens when you have all of the skills and all the experience that you need, but you cannot prove to a hiring manager that you are worth 60, 70,000 of their budget? None of this matters. And that is the gap that 10 Analytics exists to close. Now, it's very easy. You could go on YouTube, you could go on Udemy, on Coursera, and you could go learn a new course. But it is something else entirely for you to learn how to become employable in today's ever competitive market. Now, we have been doing this for over 5 years, and in that time, we have helped over 3,000 people transition from the classroom into their very first jobs in tech. And I'm talking about global jobs around the world, in the UK, in Canada, in Europe, in Asia, anywhere they wanted to transition into, so long as, they could travel there, so long as it was remote work, they could find jobs there. I'm going to say that again. Over 3,000 people, not theories, not promises, actual people with actual jobs earning real salaries. I want to be very honest with you. A lot of people claim that they can get you into tech. YouTube is full of free courses, like I said. So the question is, why should you trust 10 Analytics? Why should you believe anything that I'm sharing with you today? So take a look at this. In 2024, 355 people got jobs after 10 Analytics. That's in 2024. Now, one thing to keep in mind is for every person who shares their story with us, there's 10, 15, 20 other people whose stories we never get to hear. But in 2024, we were able to track 355 people who got jobs right after 10 Analytics because they shared their stories with us. Now, in 2025, that number went up from 355 to 426, over 426 in just 1 year. Now, while other training programs are seeing, people struggle to find roles, while the job market is getting more competitive, our graduates are landing more jobs, not fewer. So what does that tell you, because this is data, it tells you that our system, our framework, it works. And it works better every single year because we are constantly improving, constantly adapting to what the market needs, constantly staying ahead of the curve. Now, I want you to think about something for a second. 426 people last year. That means somewhere out there right now, there are over 426 people who were sitting exactly where you're sitting 12 months ago. They were tired, they were stressed, they were underpaid, they were uncertain. And today they are working remotely for international companies, building wealth. So, what is the difference between these people and everyone else who stays stuck? It is because they made a decision and they took action. Before we go ahead, I just want to point something out real quick. The global health tech market was valued at over 250 billion in 2023, and it is currently projected to reach 660 billion by 2030. That is not just growth, that's an explosion. It means that every single major tech company is pouring money into healthcare. Think about Google. Google has Google Health. Apple has HealthKit. Microsoft has Azure for healthcare, and Amazon has Amazon Care. And it's not just the giants. There are thousands and thousands of startups, Babylon Health, Hims and Hers. All of these startups are desperately hiring for roles in data analytics, product design, engineering, product management, business analysis. And like I said before, these companies cannot find enough qualified people. And where there is high demand and low supply, what happens to salaries? Can anyone tell us what happens to salaries where there is high demand and low supply? Who knows what happens to salaries? I want to be sure that we are all here. So I would love this to be a super interactive class. Who knows what happens to salaries when there is high demand, but the supply is on the ground? Just one person can just type in the chat box and tell us what happens when there is high demand for talent. And thank you so much. Thank you. Salary increases. Exactly. But one of the reasons why this is a limited opportunity, because the more people who know about it, it means the more people who get talented in this field. It means, now finding these talents becomes a regular thing, and then that salary starts to drop. So the best time for you to get into a field, especially the fields that I'm going to be walking you through, is yesterday. The second best time is today. So when I say over 426 people got jobs last year, I want you to understand that some of these people position themselves in high growth sectors like health tech. And I'm going to be walking you through some of their testimonials as we go on today. Now, let's talk about what your most valuable asset is. And shocker, it is not your job title. It is your lived experience. The most valuable gold mine that you have right now is your lived experience. Now, if you work in a clinic, a hospital, a care home, a community mental health team, or maybe just support service, this is your world. You are an expert on how the system works. You know what the forms don't capture. You hear what the charts don't say, and you carry the emotional weight and logistical load of care every single day. And I think that is a lot of data that you're processing on the back end because you have context in this field. Now, every tech company that is building healthcare products is desperate for someone like you. Let me tell you the difference between someone who has experience or context in healthcare and someone who does not. When you're building in tech, there's something that we always call empathy, design thinking when it comes to tech. And that means putting yourself in the shoes of whoever it is you're solving a problem for. And that applies in on every level. It even applies on the level of data. Sometimes data is not just about what your screen is telling you. It's not just about what the numbers are telling you. It's about insight. It's about context that you have. And that gives you this level of understanding and visibility that just crunching the numbers doesn't give you. It gives you a unique perspective. It gives you a completely different angle of seeing problems. And this is one of the reasons why companies, health tech companies are looking for people who have healthcare experience because you understand the world of health tech. You understand the human truth behind that. You understand, why you want, maybe you currently work in care, maybe you work in elderly homes, maybe you work with young children. You understand what the shift schedules look like. Maybe you're a doctor, you're a nurse on call. You understand what it means to run around when there's an emergency. And that is something that no one who has, people who do not have that level of experience, they cannot design a proper solution for that. And this is why I said it is a gold mine and you do not even know it. So the question is it possible for you to take all of this experience, even though it is not tech, and use this to transition into a technical role or use it to transition into tech itself? Now, there's something we call transferable skills. And I'll take a step back from health tech and healthcare to give you a perfect example. Let's say that you are a teacher and you give a kid homework one time and then his parents come to school or his mom comes to school and she's very pissed off because there's just a lot of homework for her kid. And she says, "Hey, what's going on? We gave my kid so much homework. He barely had time to rest last night. And you can tell that, she's very pissed off. And maybe someone else would have escalated based on how she approached you. But you take a step back and you say, okay, I'm sorry. You de-escalate the situation. You ask her to sit, you ask her if she'd like a glass of water, and then you take your time to explain why. Oh, I noticed that your kid is talented, and this is why I think that he needs more homework so we can hone his skills. Maybe we can work on building something together for him because he has a lot of talent. But what you have just done there is what they call stakeholder management. You have taken a situation that could have turned into something serious, that could have escalated into something critical, and you have de-escalated it. Now, this is something that would be useful even let's say you're transitioning into healthcare. This ability to talk to people who are escalating and then de-escalate that situation, what we call stakeholder management, is something that would be incredibly useful if you pivot into healthcare. Now, imagine all of the skills that you build in healthcare, the background understanding that you have, the context that you develop. This is transferable skill that you use to pivot into health tech. So that experience, it is not wasted. Okay, so that's one thing I want you to keep in mind. If you have years of experience in healthcare, it is not wasted. Now you might be wondering, who is this person who is having this conversation with you and why should you believe it? Well, my name is Lola Femi, and for over a decade, I have built and scaled tech companies across continents. In my world, it's all about systems, operations, and results. Now, I've been head of operations, I've been product lead, um, I've been chief operations officer. I've worked across different industries in different continents. Now at Tech Analytics, I focus on one system, and that system is to turn dedicated professionals like you into high value global hires. Now, what I'm going to be walking you through is not about inspiration. I'm here to walk you through a blueprint to show you that regardless of how many years you have spent in health tech, of how many years you spent in healthcare, your experience is valuable and it's enough for you to leverage to move into the next level of your life, which is health tech. Now, I'm going to be walking you through that. And like I mentioned before, keep an open mind and keep asking yourself, what if it is possible for you to fully step into this? Now, I want to show you a story. This is Judith, one of my favorite stories in 10 Analytics. And Judith was a carer in the UK. You see, one of the things I really love about Judith's background is the fact that, Judith went through three different journeys. Judith was from Nigeria, and in Nigeria, she worked in the HR department. And then when she moved to the UK, she started working in care, and she was doing this while she was studying. I think that for a lot of people here, this is something that you can relate to. So maybe you travel abroad, you're in a completely different country, and you decide, I just have to survive. I have to do something so that I can get by. And one thing leads to another, and you find yourself working in an industry that maybe never thought that you would work at, and you just tell yourself this is temporary. I just want to do this, and then when I get my new degree, I'm going to do something else. And that was Judith's story. However, Judith wanted more. She had experience, and she felt like, I can use this to do something different. But the problem was Judith just didn't have a roadmap. She had no idea how to move from where she was right now to where she needed to be. Human resource, and now she was working in care. So she felt this is very difficult. And then, luckily for Judith, she encountered 10 analytics. And this actually happened, she was just at her son's school. She met up with someone who referred 10 analytics to her. And she said, okay, I'm just going to give these people a shot. So Judith joined 10 analytics, and she completed her business analysis program in March 2024. Now, what is truly exceptional about Judith's story was just 3 months after this, Judith got a job as a business analyst in the US, working remotely from the UK. And I think that that is absolutely amazing. Now, Judith's story isn't just about being exceptional, it's about being strategic. It's about recognizing that a hands-on experience was not a limitation, it was her advantage. She just needed the right skills to package it for the tech world. But this is something that she would have had no idea how to position if she hadn't come into 10 Analytics. Now, Judith is living proof that your current role isn't where you're stuck. It is where you start. Your knowledge of care, of crisis, of bureaucracy, of human needs, that is your foundation. And all we're going to give you are the tools to build a career on top of it. Okay, so I just want to be sure that everyone is still with me. So if you would like us to keep going, just type, yes in the chat section. You can do that in caps. Are you ready for the next stage? Okay, Rama said yes. iPhone said yes. Okay said yes. Ikechukwu said yes. Amazing, amazing. Ini, Phidias, Olufemi, awesome, awesome. I love how pumped up everyone is about this. Now, I know that there are some people here who can most likely relate to Judith's story. And I want to tell you that if you're someone here, you relate to Judith's story, you could be the next person whose story we share in a masterclass just like this. Now, let's talk about the 4 pillars of healthcare to health tech. Now, you see all of these pillars that have been listed out here from pillar 1 all the way to pillar 4. This is all about the unique advantage that you have as someone who has context in healthcare. Now, let me give you an example. A software engineer can build a beautiful button that says, mark this task complete. But you, as someone who has background in healthcare, and this is for pillar 1, which is deep domain knowledge and intuitive problem solving. As someone who has background and context in healthcare, you understand that, just because you tick mark this task complete, just because you tick that button, it doesn't mean that there's not a lot of background work that happens. Maybe a support worker has helped someone to the bathroom, a nurse has calmed an anxious family member, and a coordinator has hunted down a missing file. You see the invisible steps that comes before the click. And that context is something incredibly powerful. For pillar 2, which is building professional network and user access, we get questions like, okay, so I want to move into a different career path. Do I maybe quit my job and then just focus on this? And one thing that we always advise people, especially if you work in healthcare is your unique experience. That is your superpower, what you currently do. So if you currently work in healthcare and you're looking to move into health tech, the network that you have built over time, the professional network that you have around you, those are your first users. That's your user access pretty much. I'm going to tell you a story. We had a student who came into one of our clarity sessions, and we had a conversation. She said she worked in healthcare. She was working in care at the time, and the reason why she wanted to take a program at Tenalytics was because she was looking to build a software solution in the care industry. She had noticed several problems that needed to be solved, and she felt like there just wasn't enough. She felt that there wasn't enough solutions out there to solve these problems. So when she came in, she took a quiz, and what she got was data analytics. She came in, she had a conversation with a career consultant, and she got business analysis, and she was like asking the question, which one do I go for, BA or DA? And then, eventually she decided to go for data analytics. And in 2 months, this was 2 months after she started, she was able to develop dashboards that could predict, the likelihood of a care of a the likelihood of a ward escalating, based off certain traits that they develop, like that they display in the first few weeks when a support worker picks up their case file. And I think that this is one of the advantages of someone leveraging their professional network and user access. Now, pillar three, pattern recognition in healthcare data. This is something that someone who does not have the background in healthcare cannot recognize. As someone who has worked in healthcare before, you understand how certain patterns connect to each other. So to you, it's beyond crunching numbers on your screen. It's understanding the pattern that connects these things together. And that is what gives you insights that you eventually use to get better data and to do a much better analysis. Now, for pillar four, which is deep empathy for user needs and patient safety. Now, if you're going to be moving from health care into health tech, I think one of the most important tools that you could have is empathy. And that is because empathy makes you someone who, it makes you a better analyzer of data, understanding that, one of the reasons why, as powerful as AI is, it still has humans still have an edge, or humans will continuously retain this unique edge over AI. It's because AI does not understand human context. And people sometimes make this mistake of thinking that just because you're working in data, that it has to be 100% logical. But understanding empathy and applying empathy to your processes is important to gaining deep insights that you would otherwise not have gained. Now, let's break down your unfair advantage. Okay, so what you already have over other people, you understand invisible workflows. So you understand how healthcare operations actually work, which means that you do not have to have you don't have to have actually worked in tech for you to say, oh, I have enough experience and I'm ready to move into this role. You don't have to have a computer science degree. All you need to do is understand how healthcare operations work, and you can use that knowledge to design a solution specifically for this. You can use that knowledge, apply it to your insights and to your analysis. You speak the language that connects frontline operations to data. Now, because you've been part of the people who are running on the field, who are actively on the field, it makes you a better solution designer. It makes you someone who can see the human reality behind the numbers. And I'll tell you that that person is always going to be the better professional, above someone who doesn't have that context. Now, remember when I was talking about leveraging your professional network and user access? So if you work in healthcare, it means that you have access to healthcare professionals across settings. It means that you work with doctors, you work with nurses, whatever kind of healthcare, whatever your specific niche is in healthcare, you have access to healthcare professionals across different settings. You can also build authentic portfolio projects with real operations input. Now, for someone who has never worked in healthcare before, they would have to go and learn this. But because you have lived it, this was your life before, you can use this to build portfolio projects that seems real. And this is because you're preparing yourself to go look for a job. You're preparing yourself to become employable. And because you're already in that industry, you can develop a portfolio that screams, these are real problems that needs to be solved in the industry. And this is part of what makes you stand out in the job market. Now, you also have access to internal opportunities with built-in credibility. Now, what this means is that just because you're looking to move from healthcare to health tech does not mean that you have to completely abandon the industry. Even inside your company where you work, there's recruitment going on, and it's most likely in health tech. Some of these opportunities, your friends would have them, your colleagues would know someone who is hiring, a healthcare data analyst. And it just makes it very easy for you to pivot from where you currently are and transition into something entirely different. It's very different from, maybe you work in healthcare at the moment and then you decide to move into, say, cybersecurity. It's a completely different industry. So in a nutshell, this is right along your alley. Now, um, pillar three is your insights are 10 times more valuable. Now, remember when I said that because you have done this before, or because you are currently doing it, it makes you a better, and it makes data easier for you to analyze because you're not analyzing data from the outside. You've lived it, you've done this before, and that is why you instinctively understand the why behind the numbers. For someone on the outside who's coming in to analyze these numbers, it would seem weird to them, but because you have lived this before, you understand the why behind healthcare numbers. Now, you quickly spot complexity hiding in averages. If you haven't been the person on the front line, I'll give an example. You remember when the pandemic hit? And there was just a lot of news flying around. We knew that the healthcare workers were the ones who were on the front line. For people who did not have to live this reality, it was completely different for them. But since you are the person, or being the person who lives this reality, the kind of solutions that you design for someone who is actively on field is different from the kind of solution that someone who is, at home under the no movement order is going to design. But because you're on the front line, you understand what these people need. You understand that data. You understand how to spot complexity behind averages. You also recognize systematic problems, not just individual failure. So, for example, oh, this person is not good at their job. Maybe that's an individual failure. But because you have experience in the field, this is not just a result of a staff underperforming, or maybe it's not just because the staff is underperforming. What do their shift hours look like? How long did this person have to work? There was this news that came out recently of a nurse who was fired because I think she was sleeping during her shift. And when that happened, someone was supposed to take medication. That person missed the time they were supposed to take the medication. So it became a really big deal, and she was fired. Now, if a data analyst comes into that, because what you're seeing is, why is this person, why was this person sleeping on the job? Now, for someone who is on the outside, it's, you're lazy. But then when you now start to hear things like, well, she works the night shift. She's been working the night shifts for the last 2 weeks. And then you start to put two and two together. What's going on? And then based off that information that you're getting, you start to, analyze the data. And because you're not focused on just individual failure, you begin to identify what could probably be a systematic problem. And that's one of the unique perspectives that someone who has worked in healthcare, only someone who has worked in healthcare can have. Now, you also understand the human experience. So for you, it is not just about the numbers. It is not just about analyzing the data. You follow the experience to design and solve and optimize. Um, I'm not sure who that is, but could you mute your mic, please? All right, now let's talk about high demand roles in healthcare. Okay, we've gone on and on and on and on about what makes you the perfect fit for health tech if you already have experience in healthcare. Now, before we go on and talk about all of these opportunities that exist in healthcare, I want you to tell yourself that you do have what it takes for you to pivot into this. And this is regardless of whether or not you have worked in the technical field. You don't have to be a computer geek for you to move or transition into health tech. The only thing that you need is context. And because you have worked in healthcare, it makes you the perfect candidate for all of these roles that I'm going to be walking you through. So your experience is 100% valuable. Now, the question is, where exactly does it fit? What are the job titles? What are the actual doors that your key can unlock? Okay, the first thing is healthcare business analyst. So if you have worked in healthcare before, then you can certainly pivot into healthcare business analyst. So what does this mean? This means that you are a translator. It means that when the IT department wants to build a new patient portal, you are the one who will sit with the nurses and the doctors, and you're going to be asking them, what makes your job easier? You're going to be asking them, what can we do to ensure that, you deliver faster on your job? How can we make life easy for you through technology? You turn their frustrations and their workflows into a list of technical requirements that engineers can actually build. So if you're the person who loves to fix a broken process, this is exactly what you should be looking to pivot into. Healthcare business analyst. Now, another one that we have is healthcare informatics specialist. Healthcare, and we see a lot of people who come in go for healthcare informatics specialist actually. So what is a healthcare, what is a healthcare informatics specialist? It means that you are an architect, okay? So you don't just work with electronic health record, which is the EHR system. What you do is you help design, you manage, and you optimize it. So you ensure that it talks to the lab system. You ensure it talks to the pharmacy system. You ensure it talks to the billing system. You are the bridge between clinical needs and complex IT infrastructure. So if you're the kind of person who has ever, maybe something wasn't working, like maybe your computer, your laptop wasn't working, maybe your system, your software wasn't working, and you thought to yourself, this is just complete rubbish. I can certainly do better. I can design a better dashboard. Then you certainly should be looking at a career in this line. Now let's talk about healthcare data and reporting analysts. So what do these people do? It means that you are a storyteller. And I have to say that this is probably one of my favorite ones because it involves telling story with data. So you are the one who's going to take all of this data. I'm talking, when do patients typically check in the most? When do they check out the most? How often is this drugs used? Or how often, whenever someone is prescribed this and that, how often do they recover, like make a 100% recovery? How many times they typically have to come back to the hospital? What is the age range of people who fall under certain categories? So you would be analyzing data and using this to tell a story. You're going to be turning that into clear visual dashboards, that maybe the hospital board can look at every Monday morning. And what your report is going to tell them is, are we hitting our targets? Are we wasting money? Which of our clinics, maybe in different states, which of our clinics are more efficient? So you're the person who's going to be taking all of the hospital data and telling them to put their money where their mouth is. Now let's talk about a medical data analyst, or you can call this role a healthcare data analyst. You are the generalist problem solver in this field. Now, one day you could be analyzing patient satisfaction, and then the next day you could be analyzing surgery wait times and others. So under the medical data analyst, your playground is any data that flows through a healthcare organization. Under the medical data analyst track, your data is your playground is any data at all that flows through a healthcare organization. So in this kind of role, you will probably most likely never be bored if you enjoy dealing with a range of data. Now let's talk about the healthcare data analyst, okay? Let's talk about the healthcare data analyst. Like I mentioned, medical data analysts and healthcare data analysts, sometimes people use them interchangeably. So if you do love to play around with data that flows through a healthcare organization, you can go for any one of these tracks. Now, for clinical data analysts, what do they do? A clinical data analyst is someone who would, you can call this person like a decision, you can call this person a decision support analyst in a way. You know, you help build and maintain what we call like smart alerts inside the EHR, like the pop-up that warns a doctor about a dangerous drug interaction for a specific patient. You use data and clinical guidelines to create tools that prevent errors and standardize best practices. So if you're the kind of person who likes to follow rules and you're also passionate about patient safety, you should certainly go for this. Now, you can also become a pathology data analyst, you can become a medical imaging analyst, or you can become a healthcare AI engineer. Now, the idea is all of these tracks, in order for you to get started, the very first thing that you need is data analysis. That is the easiest way for you to break into all of this, because at its core, what you're going to be doing is analyzing data, from healthcare business analysts to medical data analysts to healthcare AI engineering. You're going to be dealing with a lot of patients' data, which is why it is so important that before you break into a role like this, that you have healthcare context. Now, let's quickly talk about one of my favorite stories again in Tenalytics, ICMAT. Now, ICMAT was a stay-at-home mom in the UK, and ICMAT had a 2-year employment gap. I think it's one of the things that makes ICMAT's story really amazing, because typically when you have a 2-year employment gap on your resume, it is extremely difficult, not impossible, but difficult for you to prove to employers that you are actually still employable. But for ICMAT, she wanted more. Now, ICMAT was in the UK. She was studying for her master's in public health when she joined the 10 Analytics Data Program. Now, ICMAT was also looking for a sponsorship. So she was thinking, I need to get into a role. I need to get a job that would be able to provide me with sponsorship. Now, for ICMAT, in January 2024, she got a job as an information analyst with the NHS. And the best part of this for ICMAT was this job came with a full visa sponsorship. That was the best part of this for ICMAT. So one thing that I always advise people, when they come into Tenalytics or they're having conversations is, I'm not really sure what I want to move into. I want to do something that, would most likely give me the opportunity to earn a high salary, that would give me the opportunity to, something I can do for a while, something that is definitely secure, not a job where I would easily be laid off. One of the easiest things that I always think of is data analysis, especially if you have worked in healthcare before. Okay, so for ICMAT, ICMAT was able to get a job with the NHS as an information analyst, and this could be you. You could be the next ICMAT. You could be the next ICMAT. Now, for everyone in the house, this slide that I'm walking you through is something that you could gain access to and look through on your own time, just in case you drop off this call at any point. So my colleagues are dropping a form in the chat section. Fill it out so you can gain access to this and watch it on your own time, just in case you drop off the call at any point. We also share loads and loads of free resources as well. So if you want to gain access to that, you have to be a part of the community. So don't forget to fill out the form so you can gain access to this. Now, let's talk about what a healthcare data analyst does. So the question is, if I were a healthcare data analyst, what would I spend my time doing? You're going to spend your time analyzing data. So this is what most of your time, most of your job would be spent, what you spend most of your job looking at, or most of your time on the job looking at. You'd be looking at loads of spreadsheets. You'd be looking at data sets. You'd be analyzing things like, when did this patient come in? When did these patients leave? Or when did the 100 patients come in? When did they check out? How many clinics do we have? What kind of drugs do we give them? What is the demographic? How many Hispanics do we have? Or how many African Americans do we have? And then we'd be breaking it down to understand the story behind the data. So you would spend a lot of your time looking at tools like this. You'll be using tools like SQL to query real patients' databases. We'd be using tools like Power BI, like Tableau, to build dashboards that your clinic can actually use. Okay, so you will spend a lot of your time looking at data like this. Now, take a look at this one on the side. So this data tells us a story. We're looking at things like length of stay. And you know that when you talk about length of stay, it is not just a number. Length of stay is a story of recovery. It's a story of maybe a delayed discharge because a care package wasn't ready. So as a healthcare data analyst, your job would be to take a look at numbers like this and to translate those numbers into insights that look just like this, that can tell, the company, that can tell the board what is working and what isn't working. So I'm going to make this as simple as I can. Your board, your investors, maybe in, say, your hospital, for example, would not want to be spending time looking at this because they don't understand this. To them, this is a bunch of data. And this is why I said one of the things you call a data analyst is a storyteller, because they would take data that looks like this and they would use that data to tell a story that looks like this, that can be easily interpreted by their audience. So your superpower is that you do not just see the data, you see the truth behind it, and you use that to tell a story. So a computer can see length of stay, 7 days. And what you see, especially because you have worked in healthcare, is you start to ask questions. Was that 7 days was that 7 days of necessary care? Or was it 2 days of treatment and 5 days of waiting for a social work assessment? And this is where your background in healthcare becomes priceless. This is the difference between a report that gets filed away and an analysis that triggers a change in a hospital policy. Now, the question is, where do you do this? Where do you do this? Because remember when I said at the start, I think I've been saying this over and over again, that one of the superpowers that you have as someone who has worked in healthcare is the fact that you can apply empathy to your data. And because of this, you can say, hey, you know what? I think you can actually tell a story that would push for change, that would inspire change in so many ways, that would help companies, drive down their costs. Hey, we could be saving money in this way. We could be increasing the care that we give to people in this way. We could drive better outcome in this way. One of the benefits of analyzing data is that is how companies grow. Because if you cannot tell what is working, if you cannot tell what is not working, then you don't know what to fix. And that is why, as someone who has experience in healthcare, your insights in an industry like this, your insights in a career field like this will be absolutely priceless. So where do healthcare data analysts work? So they work in places like hospitals. And in hospitals, they're the person who is analyzing things like why some wards maybe have better patient outcomes than others, and how you can reduce surgical waiting times. In government agencies, you're the person who is tracking things like disease outbreaks. You're analyzing public health programs. You're deciding where to allocate resources. I can't even begin to speak to how instrumental healthcare data analysts were during the COVID pandemic. In healthcare tech companies or in health tech companies, you are the key voice ensuring that the app that they are building actually solves a real nurse problem or maybe a patient's fear, because again, you understand the context behind that. In an industry like insurance or pharma, you are analyzing things like treatment effectiveness, you're managing risks, and you're ensuring that resources are going to where they need to the most. So again, what connects all of these things together at its core is data. The data that you put together that looks like this, and then you use it to tell a story that looks like this. But the difference between you and Jim, who has never worked in healthcare before, is that you have powerful insights that can be applied to understand not just what these numbers are saying, but the context behind the numbers. What makes what makes a fantastic investigator? I like to think of data analysts as like Sherlock Holmes, for example. What makes Sherlock Holmes fantastic? If you have watched maybe the Sherlock Holmes movie or you've read any of Sherlock Holmes books, what makes him really fantastic is the fact that not only can he take a look at a person and then just like, he just breaks everything down. He breaks down what you're wearing. And then based off what, it looks like you're wearing this, you're wearing red. So maybe because you're wearing red, this happened yesterday or that happened yesterday. And it's a name that he calls it when he does things like that. And he analyzes the person and he says, oh, so maybe you're probably a smoker. And because you smoked, maybe you went out yesterday to go get a smoke. You didn't have, that is exactly what you do as a data analyst. You're following a story, you're sniffing it to find where does the real problem come from. But what makes you super powered at your job, what makes you a beast at your job is having healthcare context. Okay? Having healthcare context. Now let's talk about how you can learn the skills that is required for you to land a job as a healthcare data analyst. Now, if you're trying to move into tech, that is, if you're already trying to make this move into tech, you are probably learning by only watching videos. At the start of this, I mentioned things like Coursera, Udemy, and others, even on YouTube. Actually, you can become a data analyst by watching YouTube videos. A lot of people have done it before, but you see, that is a mistake because it is not just about getting a new skill. Now, another thing that people make mistakes in is that they do not have real projects. And this is major, it's part of what holds you back. And this is part of why I mentioned before at the start that because you work in healthcare, it gives you access. It gives you access to the kind of data that you can analyze and use this to build a real life portfolio. But you know what? Even though you don't have access to that, you're in good hands. Now, number three mistake is that they have no local work experience in health tech. So you're trying to break into health tech. You're trying to become a healthcare data analyst, but you have never worked in health tech before. No company is going to hire you. You know why? Because they don't want to spend time giving you context that you could have just come downloaded with that context. Nobody wants to spend time having to train you and to show you the ropes. Nobody wants to spend time doing that. So even though you already have experience in healthcare, when we're talking about health tech, it does require you to step up to a different level. Your experience in healthcare is just a fundamental backgrounds to that. But then stepping up to the level of health tech is another level entirely. The question is, do you have that? And most importantly, is it a local work experience, especially if you're in the UK, in the US, or in Canada? Now, another thing is having generic CVs and LinkedIn. I was speaking to someone the last time, and she told me, I'm looking for a job, but why do I have to change my CV every time I want to apply for a job? And I always say something that the act of applying for a job is a job in itself. And until you start to treat it like one, you're not going to get the kind of results that you're looking for. So when your CV looks generic, maybe your CV is customized for, a job at the NHS, and then you're applying to a job at who, you are not going to get the same results. Because even though it is still the same thing, healthcare, data analyst, the kind of tools that you're looking for, the kind of context you're looking for, it may vary. And that is why you sit down, you read the job description, and you ensure that you customize your resume to suit that particular job before you apply. You ensure that your LinkedIn is in order before you apply. Another thing I would always advise is the way the profile of a person who is looking for a job on LinkedIn looks and the way the profile of someone who is not looking for a job looks has to be very different. I'm not talking about that cliche, not a cliche banner that people use where they say open to work. Do not do that. I'm talking about the way you optimize your LinkedIn, the kind of keywords that you use in your profile, the way you position your experience. People make one, two, three, four mistakes and they are not getting jobs in the market. And they think, well, maybe it's because my skills aren't good enough. Well, that's not correct. You don't have a professional mentor. You do not have access to interview prep, the kind of results that you are going to get and not the kind of results that you are looking for. Now, let's talk about what makes you a beast in the market, right? The first thing is you have to have domain knowledge. Domain knowledge, which is healthcare. And we've already established that you have healthcare experience to an extent. You are a perfect fit for this. Now, when you pair your healthcare experience with data analytics skill, which is the ability to analyze data and to use that to tell a story, what does that give you? What does that give you? It gives you access to jobs in the UK, in Canada, in the US, where you can earn salaries from £52,000 to Canadian dollars, $103,000 dollars in the USA as well, over 100K. So the next step is I want to step into this. I've decided I want to do this. What is the next step for me? The next step is for you to decide, okay, I have the domain knowledge, I have healthcare experience, and now I want to learn data analytics. So what are you going to be learning if you decide to join, if you decide to take the 10 analytics data analytics course? You'll be learning things like problem solving. You'll be learning things like Excel, like SQL, like Power BI, like Tableau, like data storytelling. You learn how to use ChatGPT for analytics. You also learn how to use Microsoft Fabric for analytics. All of these are the key learning areas under data analytics that gives you the experience that you need to pivot into this career path. Okay, so Excel, SQL, Power BI, Tableau, ChatGPT for analytics, and others. This is the foundation that you build your health tech experience on, and then you can pivot into getting a job in this field. Okay, now let's talk about the kind of tech jobs. Let's talk about how you're going to learn. So you decide, I'm ready to do this, I'm ready to step into it. A couple of things that you're going to be learning includes you're going to be learning in a project-based environment. You're going to be learning by doing the real work. You're going to be learning by building projects, by building dashboards. And these are dashboards that you can actually put in your portfolio. Now, for employers and recruiters in the health tech space, what they are looking for is to understand that you already have context in this field. They're not going to give the job, or they're not going to hire someone who does not have context in this field. So if you can prove that you have done this before, then you will certainly be a good pick. So one of the ways that you learn in a project-based environment is that you have access to real world cases. That's why I mentioned at the start that even though you don't have access to real world problems that you can solve, you're going to have that access in analytics. So while you're learning your course, while you're learning your data analytics course, you're also building your portfolio as well. You're building projects that you can now add to your portfolio. So when you apply for jobs, this is part of what you present to employers. It is part of what you present to recruiters. Now, the next step is, like I mentioned before, you learn by doing the real work, and then you showcase your work, you showcase your portfolio, and this is what gets the attention of recruiters. Now, I want to show you what some of these portfolios look like. So this is a portfolio of one of our participants. Her name is Melody, and she's a data analyst. And you can see that Melody puts together a dashboard. Do you see this? So imagine that you are Melody, for example, and then you apply for a job, and or you have your resume, and your resume is your show. Your portfolio is your tell. So your resume is where you say, I was able to improve, to optimize efficiency by analyzing our output and blah, blah, blah. And then you put all of your numbers there. But then these recruiters, these employers, they want to see what it looks like because nobody is going to hire you without proof. They want to see that you have done it before. And then you now have a link of your portfolio in your resume. So when they click on it, they come here and they're looking for proof that you can actually build dashboards that can tell a story. So in this case, as a data analyst, you would learn how to build dashboards like this, dashboards that can summarize data, total revenue, total profit. This is your profits margin, the quantity sold, average order value, total customers. This is exactly what a data analyst does. You take all of these data and you use that data to tell a story. So you can see different kinds of dashboards that Melody has built, performance metrics. She has built sales intelligence dashboards, amongst others. So when recruiters are checking out her profile, they would say, okay, so she's done something like this before. Now, I want to show you another one. This is a dashboard that was built for a hospital analysis. And in this case, this was used to she built this dashboard to let's take a look at it. She built this dashboard to analyze the emergency response of a hospital. So when you are applying for jobs like this is exactly what they want to see. They want to see that you have done something like this, that you understand their context, and you already have that background context of, hey, this is the kind of data that, the doctors want to see. This is the kind of data that nurses want to see. This is the kind of data that you can use to make decisions that can move your hospital forward. Okay, so they want to say that you can build dashboards like this that tell story in an intelligent way. So this is how you build your portfolio. And this is how, when your recruiters and, your employers are checking out your profiles, they would want to see things like this. You cannot say that you're a data analyst and you do not have a portfolio. So that's one of the things that actually holds people back in the market. Again, fill out the form that my colleagues are dropping in the chat section so you can have access to this slide and you can watch it anytime. Okay, so you also want to gain work experience as a healthcare data analyst. And this is because you want to show employers that you are the best candidate. Remember when we spoke about them not employing you, because you do not have local experience? So how do you do this? Let's go back to what I said before. You learn in a project-based environment. So we always tell our students this, our participants, as we call them, from the moment you join Tenalytics, just go to your LinkedIn profile and add yourself as a consultant. So let's imagine that, maybe you moved from, say, Kenya to the UK, and you've never, or you don't have local work experience. Maybe you're like Ikmat. And by the way, this is, what people like Ikmat did. And you have, an employment gap in your resume that you simply cannot explain to recruiters or to employers. So in this case, as soon as you join Tenalytics, you would add Tenalytics to your resume. Now, when you join Amdari, because the idea is when you come in as a data analyst, you spend 6 months. That is 6 months of learning in Tenalytics, 6 months. And then after 6 months, you complete your capstone project and then you move to Amdari. Now, Amdari is a sister company of Tenalytics, and that is where you do your internship. So in Amdari, you're going to be working on more projects, real world projects, and you're going to be building your portfolio. Now, you also have the opportunity to include Amdari as well in your resume. You have the opportunity to include Amdari as well on your LinkedIn. So now you have Tenalytics and then you have Amdari. Tenalytics is Canada and Amdari is the UK. So as someone who maybe you moved from South Africa and then you moved to the UK or Canada, now you have global experience because you list yourself as a consultant in 10 Analytics and in Amdari. So again, 6 months of learning in class and then another 2 months of internship in Amdari, which is 8 months in total. So you have UK and Canadian experience. And the best part of this is you do not just walk away with the skill, you walk away with a beast level portfolio. And then you also walk away with what we call employability skills. I'm going to walk you through that before we wrap up. And we're getting close to wrapping up here. Now, another thing is you need a reference to keep the job. Because remember what I said? You put in 10 Analytics, you put in Amdari, and you say, oh, I work as a data analyst in 10 Analytics, and I work as a data analyst in Amdari. But then when you're applying for jobs, maybe you get a job offer. Now, the next step is you have to provide reference. So in that case, who do you call? You call 10 Analytics. Now we've done this for thousands of students who have reached out and, hey, I need a reference letter. And then we write a reference letter for these students. So this is an example of a reference letter written by Adeza. And this is for Mawutin Ashaka, who got an offer as a pathology data analyst with the NHS. So even though you've graduated from 10 Analytics and you did that 3 years ago, 4 years ago, you can still reach out to get a reference letter. So now let's put everything that we've spoken about together. We've spoken about learn, which is where you learn your data analytics skill. That is important for you to transition into a career path in health tech, because at its core, health tech deals with data. Data is constantly moving, and your ability to tell a story with that data is the first step to opening multiple career pathways in health tech for you. So now once you learn data analytics, the next step is for you to package. Remember what I said about employability, because employability goes beyond having a brand new skill. Anyone can learn a new skill, but being employable is another skill on its own. And unfortunately, this is one of the skills that's very hard to learn. So first thing is you have the experience. The second thing is a CV revamp. For many people, they don't get the kind of job offers that they want because their CV is just not up to that level. So we help you out with the CV revamp. We teach you how to optimize your resume so that you can gain, so that your resume can get past what we call the ATS, which is the applicant tracking system. So when you join our community, that's something that we're going to teach you how to do. LinkedIn optimization. We show you how to optimize your LinkedIn so that recruiters and employers can find you. Portfolio, we've gone through this before. Mentorship, when you join our community, you also have access to mentors who have done this before. You can ask them questions, you can gain advice from people who currently work in health tech. Interview preparation. If you get 20 interviews in a week, we have a team who is ready to help you deal. All you have to do is log into your dashboard and you can book an interview prep with any of our career consultants, and they'll have a conversation with you, get on a call with you, a video call, and show you the steps on how you can show up to your interview fully prepared. Job reference, as you have seen, we provide job references. And then another thing, which is like the cherry on top, is on the job support. So even when you graduate out of 10 Analytics and you get the job, you still have access to reach out to say, hey, I need support. I'm trying to analyze something. I'm not sure what is happening, I need you to help me out with this. Now that covers learn package. Now on the apply level, this is where you tailor your application. This is where you apply to quality jobs only. I've always said quality over quantity. It is not about applying to 100 jobs. It is about the quality of the jobs that you apply to. And then you also have access as well to a paid market. What this means is the Indeed, the LinkedIn that you apply on, all of these are saturated. For example, when you're applying for a job on LinkedIn, you see things like, over 100 have applied already. In that case, it is safe to assume that, you probably have thousands of people who have applied for that job. The chances of being seen on job boards like that, because they are free, is incredibly low. Now, that's not to say that they do not work. You want to take advantage of every opportunity that you can. But we also partner with paid job boards, and then we scrape data and we present this to the data analysts in our communities. And I'm talking about remote jobs, on site, hybrid, all of them in the data analytics field, ranging from healthcare roles, to different levels, informatics, whatever it is that you're looking out for. We will find that, we will put it in an Excel sheet, and we will present it to you. And all you have to do is apply, apply, apply. Now, when you apply all of these levels and you do it with 100% commitment, the learn, the package, the apply, it will certainly lead to you getting the same results that ICMAT did, getting the same results that Judith did. Now, this system, the LPA system, has worked for over 3,000 people in our community. And dare I say that you could be one of them. Now, I've gone over the learning timeline and the duration, but I'm just going to go over it again real quick. Now, you learn for 6 months with Analytics, and then you spend another 2 months doing your internship with Diary. So what does your class look like? On Saturdays, you have a live class. Your live class can either be in the morning or in the evening. So in the morning, it happens between 11 a.m. to 2 p.m., and that's UK time. In the evening, it happens between 6 p.m. to 9 p.m., and that's UK time. It also happens between 10 a.m. to 1 p.m. MST. So all you have to do is, based off what your schedule looks like during the weekends, do you want to go for the morning class? Do you want to go for the evening class? Now you have access at all times to your self-paced watch me do it videos, which means that you can practice, it means that you can learn, and then you can now join your class and ask questions in your class. You also have access as well to a community. So at any time, you can reach out to your facilitator and say, hey, I have questions. I'm trying to do something, it's not working. You also have access as well to what we call pods. Now, some people are on this call and you would probably end up in the same pods. A pod is a small community of learners who support each other. So in your pod, you could have someone who, maybe this person works in, care. Maybe this person is a nurse, works in ER. You could have people from different parts of the world in your pod. And I think it's one of the one of the powerful things about analytics is how community driven it is. So you could, be learning with this person, say, hey, I'm not sure how to deal with this. And, you and your colleague get on a call and, you guys learn together. And then you also have access to your facilitator as well. Now you also have access to mentorship sessions. And this is, people who have done what you're trying to do right now, which is to break into health tech. You're going to hear from people like Judith, who used to work in care. You're going to hear from people like Ikmat, who was a stay-at-home mom. You're going to hear from people like Mawute, who now works in pathology data. You're going to hear from people who are working in fields that you are looking to pivot into. Now, real quick, let's talk about Toyin, who was a pharmacist in Nigeria, and then Toyin became a pharmacist data analyst with the NHS. Now, you would think that because Toyin was already a pharmacist in Nigeria, that, she already had everything that she needed, but she still needed to work in tech. She still needed to get that tech perspective. So Toyin already had the perfect background in healthcare as a pharmacist. Now, all she needed was a tech perspective to complement it. And then she joined the data analytics program in 10 Analytics. Now, one of Toyin's motivating factors was she was also particular about sponsorship. What Toyin accomplished in October 2023 was she landed a role as a benefits analyst with the NHS, and she got full visa sponsorship. So we have some people here who could be the next Toyin if you are ready to move today. If you're ready to make a change in 2026 and you say, you know what, I'm going to take a chance on myself, I am going to move. You could be the next Toyin, you could be the next Ikmat, and you could be the next Judith, starting February 7th. Now, our next cohort opens February 7th. So if you would like to get started and take charge, you want to be a part of this. Let's talk about the data analytics program in 10 Analytics. Now it goes for 1,250. That's the full amount. However, it's discounted. So you can get it at $1,000, which is 20% off. But don't run away yet. Don't run away yet. You can get started with only 150, which means you don't have to make a full payment of $1,000. You can say, you know what, I want to see whether or not this works for me. I want to see if 10 Analytics is all about that, like Lola says. So I want to get started with 150 and decide whether or not this is something that I want to do. Now, this is a discount of 20%, but it's not going to last forever. This is only available for the first people who lock down this course, who lock down this payment. Only the first 20 people are going to be able to access this for $1,000. Now, my colleagues are going to be sharing the link in the chat for you to just click on and make a direct payment. But I want to quickly show you what that process looks like. It's very easy. It is very seamless. And you can just get it done in a couple of minutes. Okay. So when you get that link, all you have to do is click on the link, and it's going to take you to a page where you can select the course that you are interested in. Now, in your case, because you have healthcare context, because you work in healthcare field, what you are looking to go for is data analytics. So you want to navigate to the data analytics section, and you want to lock down your spot for the 7th of February cohort. And yeah, so you come here, you click on buy now. As you can see, it's been discounted from $1,250 to $1,000. When you click on enroll now, all you have to do is put in your details like your full name, your email address, your phone number, and you are ready to get started. Okay, so I'm going to put in my full name, and then I'm going to put in my email address, and then I'm going to put in my phone number, and I'm just going to click on this. Real quick, I just want to show you how very easy it is for you to get started in tech. Okay, I'm just going to change this. I'm using a temporary email, so you want to make sure that you use a real email, because this is how we're going to access you and how we are going to send you information on how you can access your course and get started. So use an actual real email, and don't be like me. Okay, so I'm just going to fetch a temporary email from this link. Just give me a minute. Okay, and yeah, I think we should get that now. Okay. All right. So, okay, fantastic. So I'm just going to copy this email, and we're just going to go there and paste it. Awesome. All right, so I'm just going to go here and I'm going to paste this, and yeah, we continue again. And I think we should be good now. Amazing. All right, so on the first step, your full name, your email address, your phone number, and then you scroll down. Now we have two different kinds of cohorts. One cohort starts February 7th, and then another cohort starts in March on the 7th. But I would always say, you know what, just get started immediately instead of waiting. Just get started immediately. So I would say go for the February cohort instead of the March cohort, but maybe you have commitments. Maybe you have something that you've already planned and you cannot get started in the next 1 week, then you can go for the March cohort. But the discount still applies if you decide to go for the March cohort. It also applies if you go for the February cohort. But whatever it is that you do, lock it down. Now you can also select your preferred currency that you want to, if you want to see what it costs in pounds, if you want to see what it costs in CAD, you can do that. Now for what you can see, we have different types of payment plans here. You can choose to make a full payment. You can choose to pay 2 monthly installments, in 3 monthly installments, in 5, or in 4 monthly installments. Now, if you choose to pay in 5 monthly installments, you can pay $150 and get started. And then subsequently, you'd be paying $212 monthly for the next 4 months. Every other plan starts at a much higher band, which is 250 to get started. And then, for the 2 monthly payments plan, it's $487. And then if you make a full payment, you get an extra discount. So instead of paying $1,000, you'd be paying 975. So it depends on you. It depends on what kind of payment works for you. So I'm going to apply my discount here, and it's going to take me to the next page for me to complete my sign up. Now, one quick thing I want you to notice on this page, for people who say things like, oh, I'm not sure this days doesn't work for me because maybe I get my salary middle of the month. So if you pay on the 28th, notice what happens here. Your next payment is January. Your first payment is on January 31st. It means your next payment is going to be on February 28th, your third on March 30th, and so on and so forth. So if you want to change your payment date because maybe you get paid middle of the week or something, you could maybe move it down to the latest, which is the 7th. And then you can see that impacts, your payment date. So your second payment is March 7th, April 6th, May 6th, June 5th. So you can change your next payment date up to the next 7 days. So if that applies for your use case, feel free to use that. Now I'm just going to confirm that my information is correct, and then I am going to pay. It's that easy. So this takes me to a page where I can input my card details and complete my payment. So in how many steps you went? 1, 2, 3, and 4. We're about to complete the payment process. It's very simple, very easy, and very straightforward. So on this page, you put in your card details, but I'm going to be using my test card details. So don't think these are real card details. And so you want to put in your card details here. I'm going to put in my month, and then my CVC, and then put in my cardholder name, and then you can, select your region, and then you pay. So it's that simple, very easy and straightforward. And that's it. You've gotten access to your dashboard. Now, before you complete your sign up process and actually access your dashboard, we request for a few information. So first step is you have to verify your email. And then the second and in this case, you just go to your email. You'll see 3 types of email here, which is your verification email, your account password, and then you also find your receipts there as well. So you want to go to the verify email and copy your code and then just paste it there, and that's it. So we request different types of information before you complete your dashboard. And this is to ensure that, you are ready to start your learning journey. So we'd be asking you things like, what class do you want to go for? Your live classes. Remember, we have 2 different types of live classes. We have the ones that happens in the morning and then the one that happens at night. So this is where you start to design what your learning experience is going to look like. And when your cohort starts on February 7th, this is the schedule that you would automatically fall into. So once you complete this, which is you input your code, you can see here that the next thing is for you to select your country of residence. So this is just you completing your profile, and then you select your preferred schedule. So if I want to go for the morning classes, if I want to go for the evening classes, I can select, and this depends on what my schedule looks like. You can also select where you heard about analytics. If you have a different kind of email that you prefer, you can also input your preference here as well. If you have a referral code, maybe you were referred by someone, because we do get a lot of people who were referred. We do get a lot of referrals. You can also input your referral code here. And then you can also input what made you register with 10 Analytics. Now, another thing is how much time are you willing to commit to this weekly? I would be hoping that, you're signing up, you're saying, I'm going to commit as much time as I can to learning and, fully transitioning into this role. And that's it. You have completed your learning experience, and then you gain access to your dashboard. Now we have what we call a readiness, an onboarding checklist. And this onboarding checklist just includes a couple of things that you have to do before you access your dashboard. So we want you to meet your facilitators. You're going to be seeing, pictures of the people who are going to be teaching you in class. We're also going to be teaching you at this level how to download and install the required tools. Like you need Power BI, you need Tableau. How can you install these on your computer? So we're going to be showing you videos and teaching you how you can do that so that you are ready before your cohort begins on February 7th or March 7th, depending on what time you select. So once you complete your boarding, then you gain full access to your dashboard, and you are ready to get started with your learning. So it's that simple, that straightforward, and you are signed up for the 10 Analytics Data Analytics track. Now, one thing I want you to keep in mind as we wrap up this session is it's 2026, and this is the best time for you to get into health tech. This is the best time, especially now that AI is completely changing the industry. We're generating so much data at a much faster pace than we used to before. The moment you sleep, even when you're sleeping, you're generating data. We have wearable devices that people use to monitor things like their heart rate when they're sleeping. So now more than ever, the world is generating data, billions and billions of data. And these health tech companies need data analysts who can help them analyze this data, use it to tell stories that can tell them, what do we have to double down on? What do we have to do more of? What do we have to do less of? And you could be one of those people leading the charge, especially since you already have the right positioning to do so. Now, as we wrap up, one more thing is 10 Analytics is accredited by the American Council of Training and Development, which means that, we're certified, we're registered in Canada, and the kind of courses, the kind of experiences that you get in 10 Analytics is pretty much global. And then I have to also mention this because again, I've been saying this like throughout the session, it's not just about you learning a skill, it's about you becoming employable. So beyond, oh, I'm getting a nice certificate, because the people who are going to hire you, this is not what they're looking for. Remember the portfolios I showed you? That is what they are looking for. They want to see that you can build dashboards. They want to see that you understand healthcare context. They want to see that you understand how to solve their problems, how to analyze patient data. They want to see that you are passionate about doing this and about telling stories and about helping solve problems using data analysis in the healthcare industry or in the health tech industry. This is what really truly makes you stand out in the market. When you pair that with employability, it means that your skills will never go ignored in the job market. So what are you waiting for? It's the best time for you to get into health tech with 10 Analytics. Now, another thing is we got into the Alberta Catalyzer Velocity Program, and this was in October 2024. So if you haven't filled out the form yet that my colleague is dropping in the chat section, please fill out the form so you can gain access to this, and you can, check it out and read the article. Okay, so that pretty much wraps up everything. I don't know if we have any questions. I'm just quickly going to look through the chat section and see whether or not there are any questions for me. Shegun is asking, what about PayPal? Shegun, if we go to, okay, I can see that Elijah has already, fantastic. So just send an email to accounts@10analytics.org and someone is going to attend to you real quick. Okay, so do we have any questions? Ade is asking, I have taken data analytics and data science with 10 Analytics in 2023. How do I bypass that and move into the projects for healthcare? Okay, I can see that Afolabi is also, oh, fantastic. Elijah has responded that we launched a data school for health professionals only. So please, for everyone who shares, a story like Ade, send an email to account@10analytics.org. Afolabi is asking, I completed data science in 2025. I suppose the curriculum is still the same, but using healthcare to promote, hopefully we can get some related healthcare projects to get into. Absolutely. You can do this with the health tech data school, and this is for only healthcare professionals. So for you to get into this, please send an email and, someone is going to respond to you and show you what the next step is. Do we have any questions? You can drop your questions in the chat section. if you do, or you can raise a hand and I will take a question. Any questions before we wrap up and call it a day? Because I'm not seeing any questions in the chat section. Do we have any questions? Feel free to, if you want to chat me privately. Someone is saying, please send the email address for health tech. Okay. Elijah, if you could share the email address, or if you just copy that and send that to you. So I'm just going to respond to that message with the email address. You can send an email to this, Yinka. Do we have any other questions? Or is everyone fantastic? Everyone is good, right? Okay, so I guess we're all good. Thank you so much, everyone, for staying in the Thank you so much, everyone, for staying in the session this long. It's been about an hour and 30 minutes. Now, if you're still confused on what the next step is, please fill out the form that my colleagues are dropping in the chat section, and you can book a clarity call. So you can get into a conversation with a career consultant, and ask questions regarding the data analysis program to see how it fits into your career path or your previous career in healthcare. So thank you so much for being with us until the end of this session. On behalf of my colleagues and I, we look forward to seeing you in the next cohort that is starting on February 7th. So thank you, everyone, and bye.